When there is insufficient blood reaching the vital organs, it can lead to death. This type of condition is called circulatory shock. There are several kinds of circulatory shock, and we're going to look at three of them. Hypovolemic shock, which means shock due to low volume of blood. This can happen due to trauma or injury and blood loss. The next one is anaphylactic shock, which is caused by an allergic reaction that is very severe. The third type of shock is called septic shock, and this is caused by a bacterial infection. Each one of these shocks lead to death in a matter of minutes to hours to days. We're going to take a closer look at each of these types of circulatory shock. Let's take a close look at the process of anaphylactic shock. Anaphylactic shock is caused by an allergen. Some people have a severe reaction to an allergen. The allergen could be peanuts, shellfish, dairy, or a wasp sting. When the body is exposed to this allergen, large quantities of histamine are released. Histamine is a chemical that makes everything leaky. It makes capillaries leaky, and it causes the arteries and arterioles to dilate hugely. There is a massive vasodilation in all the arteries and arterioles in the body. When there is a dilation in an artery, the space inside the artery increases. Remember, we said volume increases. When volume increases, pressure decreases. So the pressure inside the arteries decreases. As a result, because all these arteries have lowered pressure, peripheral resistance goes down significantly. We call this peripheral resistance because these are the arteries and arterioles that are peripheral to the heart. So the peripheral resistance goes down. Whenever peripheral resistance goes down, blood pressure always goes down. So there is a huge drop in blood pressure. We need blood pressure to pump blood to all the vital organs, especially starting with the head, because you need more pressure to send blood to the head. So blood to the brain and other major organs like the liver and the kidneys goes down greatly, so it's not pumped to the vital organs, and that leads to death. We call this anaphylactic shock. The treatment for anaphylactic shock is epinephrine. Epinephrine is another name for adrenaline, and it is given to the person in the form of an EpiPen. If a person has an EpiPen, they can use it right away. Otherwise, it is administered intravenously. Epinephrine is a potent vasoconstrictor. If you remember, histamine causes vasodilation, epinephrine causes vasoconstriction. So it opposes the effect of histamine and it brings things back to homeostasis. It goes back to the normal blood pressure, and blood can now be pumped to all parts of the body. So it reverses the effects of histamine and brings the blood pressure back to normal. The next type of shock that we will look at is septic shock. Septic shock is caused by a bacterial infection. It is very common in nursing homes and among patients who are immobile. These patients develop what are known as pressure ulcers, which are lesions in the skin, and this can lead to septic shock. So let's take a look at how a pressure ulcer can lead to death. So here we have the pressure ulcer. The pressure ulcers are infected by a particular kind of bacteria that always lives in the skin called Staphylococcus bacteria. You may have heard the name staph infection. So this bacterial infection is caused by Staphylococcus bacteria or staph bacteria. Staph bacteria, once in the bloodstream, release toxins, bacterial toxins. These bacterial toxins cause massive vasodilation. We saw that earlier with the anaphylaxis. In the same way, massive vasodilation results in a drop in peripheral resistance. So there is an overall drop in peripheral resistance in all the arteries and arterioles. And when this happens, it results in blood pressure going down. So there is a severe drop in blood pressure because there is a severe drop in peripheral resistance. So when the blood pressure goes down, there is not enough pressure to pump blood to the vital organs, resulting in the treatment for septic shock is antibiotics. Antibiotics are chemicals that work only against bacteria. So the patient is given antibiotics intravenously until the blood pressure goes back to normal and all vital statistics return to normal. The third type of shock is hypovolemic shock. Hypo meaning less, volemic meaning volume. This means the blood volume has become dangerously low, leading to death. This is caused often by trauma. So if a person has been injured and is suffering a great deal of blood loss, hypovolemic shock is the result. So when there is a large amount of blood loss, blood volume goes down greatly. So when blood volume goes down, blood pressure goes down as well. Blood pressure goes down greatly. And now there is not enough pressure to pump blood to the vital organ. And this results in the treatment for hypovolemic shock is blood transfusion. Blood has been lost, so blood must be replenished.